Hello, I am Dr. Khalilah Jefferson, DNP. Today, I would like to discuss bridging the gap between concern and care in pediatric medicine. Last evening, a parent once rushed into clinic and said, "My child has had a fever for 3 days." So I asked how high. They paused and said, "Oh, I didn't check, but I can tell." And if you've worked in healthcare or you're a parent, you've probably heard some version of this. Because fever doesn't always mean a number. Sometimes it means they feel warm. They're not acting like themselves. I'm worried. And here's where we have to pause because it's easy as clinicians to think, why didn't they just take the temperature? But that question misses something deeper. Not every family has a thermometer, knows what counts as a fever, or understands when it actually matters. And more importantly, not every parent has been taught how to translate worry into data. This isn't just a knowledge gap, it's a communication gap because in medicine, we speak in numbers. 101.3 degrees, duration 72 hours. But parents speak in experiences. They're clingy, they're not eating, they just don't seem right. And both are valid, but they don't always connect. When that gap isn't bridged, fevers may be overestimated or underestimated. Anxiety increases, care becomes reactive instead of informed. And sometimes we miss opportunities to guide instead of just correct. This is where nurse practitioners are uniquely positioned because our role has never been just to diagnose and treat, it's to translate, not just medical terms, but meaning. Bridging the gap doesn't require more time, it requires a different approach. It can sound like, instead of, "Did you take the temperature?" try, "Tell me what made you think they had a fever." Instead of correcting, start with curiosity because that answer tells you everything: what they notice, what they fear, what they understand. And from there, you can teach. We can say, a fever is actually a number 100.4 or higher. Here's how to use a thermometer. Here's when to worry and when not to. Not in a rush corrective way, but in a way that gives parents confidence the next time. Because what if our goal isn't just to treat the child in front of us, but to empower the caregiver who walks out the door? Because when a parent says, "My child has a fever," they're not just asking for a diagnosis. They're asking, "Am I doing this right? Is my child going to be okay?" And maybe the most powerful thing we can do as nurse practitioners is not just give the right answer, but teach someone how to find it the next time.